Trauma-Informed Care – Introduction to the course. Welcome to this Trauma-Informed Care e-learning course. In this course we'll explore the topic of trauma and the implications of trauma for our practice or service delivery. Trauma is much more common than you might realise. Many of us are likely to experience trauma in one form or another during our lives. And all healthcare professionals are likely to come face to face with traumatised individuals, even if they're not specifically diagnosed as such. Throughout this course we'll refer to lessons for clinical practice, but these are equally applicable to anyone who comes into contact with traumatised individuals during the delivery of a professional service. The aim of this course is to help us provide trauma-informed services on both an individual and an organisational level. A trauma-informed approach to our services is important for two reasons. By recognising the subtle signs of trauma in individuals, we can respond appropriately and with empathy. And we can avoid inadvertently re-traumatising those who are seeking our help. This course is designed for any professional who provides a service or care to the public. The course will provide you with a basic understanding of what trauma is, its prevalence, and how it affects us. You'll learn how to detect signs of trauma and respond to it with sensitivity, and how to support traumatised individuals whilst preserving your own well-being. This course will help you understand how a trauma-informed approach can make a real difference to our service users' health and well-being. Now let's look at what we'll cover in each module of this course. In Module 2, What is Trauma?, you'll be introduced to the concept of trauma. We'll consider the definition of trauma, we'll explore the personal meaning we attribute to trauma, and we'll explain why some types of trauma lead to a diagnosis of PTSD, whereas others do not. In Module 3, The Impact of Trauma, we'll consider how trauma affects an individual's health and well-being. We'll explore how childhood trauma can impair our social and emotional development. We'll consider how our response to trauma manifests in our behaviours. And we'll explore the wider impact of trauma on society as a whole. In Module 4, Trauma-Informed Services, we'll ask why we need trauma-informed services. We'll consider what characteristics these services should have, and how we can ensure these services are responsive to cultural and social factors. In Module 5, Working with People Affected by Trauma, we'll explore how trauma can affect an individual's behaviours, and how recognising these behaviours is important in trauma-informed approaches. In Module 6, Treating Trauma in Individuals, we'll look at some of the tools and techniques for treating trauma. We'll consider the basics of trauma treatment. We'll look at some techniques for managing traumatic memories, and we'll explore how we can build our own resilience when hearing about and responding to traumatic experiences. In Module 7, we'll summarise what we've learnt so far about trauma and trauma-informed services. The final 3 modules in the course will focus on one of the groups most affected by trauma, Armed Forces veterans. We'll consider how we can shape trauma-informed services around the individual needs of veterans. In Module 8, we'll explore the different motivations people have for joining the armed forces, and the different experiences they can have during their time in service. In Module 9, we'll explore some aspects of culture in the armed forces, and we'll consider the implications for clinical practice. Finally, in Module 10, we'll look at the challenges faced by veterans during their time in service and when they transition back to civilian life, and again the implications these challenges pose for clinical practice. Trauma is a complex subject that must be approached with sensitivity. We hope this introductory course provides you with the insight and tools to ensure a trauma-informed approach is an integral part of the services you provide.